number of young people that are pregnant, they have children, they are HIV positive, and these young people are indulging in sexual activities not just with their fellow young people, but even with the older generation that is actually coming up and putting these laws together. So we have a lot of work to do in Africa. We have a lot of interventions, but most of these interventions that we have been implementing, I would say they are falling on rocks and not on a fertile ground because we don't have a supportive environment to ensure that our interventions yielding the fruit that we expect them to yield. So this has been the young people's voices, their perspectives on access to sexual reproductive health services. And I know the audience could be itching with a number of questions and contributions, so I'm just going to ask, I'll give back the mic to the main chair. I was told I'm only remaining in a few minutes and my minutes are gone. I don't know if you're going to allow us to get even just 2 questions or 2 contributions from the audience. I can see we already have hands.
So, may we kindly have a roving mic just to support this reflection. Please go ahead.
Thank you so much for the opportunity. My name is Lord Wendirimire, University of Zimbabwe, SRHR Vice President and Minister of Health in Zimbabwe. I just want to just give a remark, especially from all the panelists we were talking about access to SRHR. And I should say, representing my community as the disability community, is still a thing, and we are actually facing a lot of barriers in accessing SRHR services and even information itself. If you go to the hospital, they will say, you are already a burden, why do you want to get another burden? How did you end up, if let's say you want to be tested for HIV, say, why do you want to be tested? How did you even know it in the first place? So at the end of the day, that barrier is there. And also talking about access to information itself. Is the information in braille, is the information also in light print? So these are some of the things that we are in the first image. Just wanted to know if all these representatives are putting enough work in making sure that information and also access to SRHR are also available for disabilities.
Thank you so much for your submission. I hope you are taking note of the importance of disability inclusion in your programming and work. Please take note of the question and we'll give you an opportunity to respond. Please.
Thank you so much, Chair. One Zambia. Are there Zambians in the room? One Zambia. One Africa. We can do better than that. So in Zambia, we say one Zambia, one nation, meaning we are one people. And then when I say one Africa, we say one continent, because we are one people, right? One Africa. My remarks are as follows. Firstly, I would like to ride on my brother Weston, who said most of the countries in Africa, Chair, are culturally embedded, and we are still very much a rural population. Young people in rural areas still face challenges because most of these services and information we speak about are in English. So we need to reach a point where we begin to translate this information in various languages. I heard Doc mention in his presentation that this might be hard, but this now is a priority because most of those young people do not understand. Secondly, is that the case for Zambia is quite unique. And I know that Youth Advocates Zimbabwe a couple of months ago where we met with policymakers and we were speaking about some of these issues. And then we told them exactly what my brother on the panel said. And they told us that, look guys, changing the law is not as easy as you're speaking about here. Plainly simple, put like that. Changing the law is something that takes 5, 10, 20, even 50 years. So the call they gave us is, what can we do besides that? Besides changing the law itself, what else can we do? And that is the question I'm posing to the room. Because changing the law is hard, and this came from the policymakers. My last comment, I recently attended the United Nations General Assembly in New York. The key thing that came from that conversation is that there's a system that exists, but the system is not responding to the needs of the young people. I can see people shaking their heads. I'm glad that they agree with me. The system is not responding to the needs of the young people. We understand that we found this system. It's been in existence for a very long time, but it needs to respond to the needs of the young people. Unfortunately, Chair, this system is rigid. It can be a health system, it can be an education system, any kind of system that exists in our countries is not responding to the needs of the young people. Now, how do we begin to do that? How do we begin to hold each other accountable? I was really looking forward to hearing SADC and African Union's sentiments on this, because these are regional bodies. What are they doing to hold governments accountable? When we go back, you still find this conversation. And politicians will always say, that is what they do. But what are these regional bodies doing to hold them accountable to the commitments that they make? It's sad that, over 10 years after we agreed to the Abuja Declaration, only 2 countries out of the over 50 countries in Africa have managed to reach that 15%. And they've only managed to do that once. Think about how bad that is. In my country, they recently announced the budget. We are only at 11 point something. That's still not enough. But what can we do? Because we as the young people are here in such spaces speaking to the policymakers. But it's increasingly shown that it is not enough. So what can these regional bodies support us in re-echoing our message that we need our governments to begin to honor their commitments? It's enough to. Thank you so much.
Thank you so much. Hey, those who were here you had the submission very clear. Thank you so much.
Thank you so much. My name is Ayebare Margaret Williambo, and I'm a member of Parliament in the National Assembly of Uganda. I'm glad to be in this space. I have worked with young people. Before I joined politics, I was working with the Ministry of Health in HIV programs and specifically with key populations. So I used to meet so many young people, and I happen to be a member of so many young people organizations and key population organizations that some of them, the sex work-led organizations, and they are board, as their board treasurers, they are board member, and I want to appreciate young people. One thing that has prompted me to raise my arm is when the last speaker said, why are systems not responding to young people's issues? It is a question to all of us. Why are systems not responding to young people's issues? I want to say this. I've said it before and I'll continue saying it. Young people, it's high time you come out of wherever you are. If you need a lift, no one is going to find you home. You have to come to the roadside if you're waiting for the lift. I don't know whether I'm making it clear. Come out of your homes, get to the roadside, someone will find you there and give you a lift. Involve yourselves into work. Leave this business of young people sitting in offices, doing the paperwork, beginning to budget for conferences and meetings when you don't even have a single coin in your pocket. Youths, you're complaining of finding old women in hospitals who are nurses, who are midwives that are treating you badly. Come out and begin doing work. If you're given such jobs, you are a nurse, you are a young doctor in a certain hospital, you only work there 2 days, 3 days, and you want to earn money like a doctor who has been working there for 25 years. soon you will abandon the job. Majority of you youth activists are centered in capital cities and regional towns. And you're telling us that you're advocating for the poor youth. Take your advocacy, take your organizations to the rural areas. Leave the cities, leave the towns, go and help those people you're advocating for. I want to tell you, stop the business of creating organizations day in, day out. Each one of you wants to be an executive director. And you find you have so many organizations doing the same work with no results. Youths, we are going to help you, but first help yourselves. Let me stop there for the meeting.
Wow. I have no other words to take. She's really here. Thank you so much. All right, I see someone is ready there.
My name is Yeo Kondwe, FP 2030, focal point for Malawi. I would like to concur with what the last speaker just said. I'm a young person, and I heard one of the advocates speaking. I only love high-level meetings. I cannot go to the community, and you call yourself an advocate. I think it's high time, young people, we really need to take the responsibility. We are standing for the people who are in the communities. Let's design projects, whatever programs, the communities, if we really want to see change. Otherwise, it will be business as usual. But also, I had a point in terms of language justice. I think language has also been a key barrier for our interventions, because I also ask myself a question: to what level are we engaging the rural communities in policy formulation processes? You find that we engage them maybe at the launching level of a policy, and we're expected to address their needs, of which they do not participate or input their actual needs in the communities. That's why we find that there's those mismatches. And when we say the policy documents that we have, they're really, they're beautiful, good documents, but the majority who are in the communities cannot even understand the English, the jargons that are put in the documents, and we expect those things to translate into action. I think we really need to change. There's somewhere where we are missing. Thank you.
Thank you very much. It reminded me of the story where when organizations like NGOs, they find themselves in nice hotels, 5-star hotels, discussing poverty alleviation issues for those in rural areas, and they've never visited the rural areas. Interesting. Thank you for the submission.
Thank you for this opportunity. Daniel Watenga is my name. I'm representing Fake Uganda. And I wanted to pick it from the point the gentleman who spoke earlier. But then Honorable Ebali took up the mic and she preempted what some of my, sorry, we come from Uganda, and I think we share sentiments. But something that I wanted to add on what she was trying to say is oftentimes as young people we are out there complaining about not being engaged in some discussions, not being in some, not policies that are not involving us. But something that I've observed is that we are not willing to work with governments, to work with the existing structures, to get us heard. And this is very common. Whereas the gentleman said at times policy and laws are hard to change or may take long to change, we have existing platforms that government has created. And if you want to create change, we need to engage meaningfully with the government. We need, now, something that young people get wrong, we are very ambitious, but we tend to fail to recognize that as CSOs, we contribute to what government mandate is. The government's mandate is to provide for the citizens. And CSO's idea we are supposed to complement. Yes, but at times we are lost in, say we are advocating for, but then we are not working with government towards that cause. So as much as we are going to come up and say, please, we need this, we need that, we need that, we need to be organized. That's the first thing. That you're not going to have all young people coming to a government sector or department, they have what they want. You need to be organized to have one voice, and that's what calls for collaboration. Collaborate, send one voice to speak for young people. Thank you very much.
Yeah, thank you so much. That's very clear. Let's not move in silos, but let's speak with one voice.
I was afraid to raise my hand because I was like, I spoke a long time. Should I speak again? But I couldn't. Because, and again, echoing your sentiments. No, I run an NGO also. Maybe I shouldn't have. But anyway, I run an NGO. And one of the things I realized, I was engaging in politics in young people. I go to the rural, to the village, and engage young people. And I was asking them, you are doing advocacy, and they tell me it's on SRHR. Do you know the Gender Equality Act? And they told me no. And I said, what kind of advocacy are you doing? Because the Gender Equality Act is the basis for sexual and reproductive health and rights. What are you doing? So it now made me think, I think we should develop a mind, a legal, that will explain the legal issues, but in the vernacular. So that we can take that one to that rule here, because we need people to understand the law itself, the legal basis. In that language, say, I have this right. That's how they can do advocacy, because they can go to the clinic and say, you know what, I have read this law, this provision, it entitles me to this. If you don't do that, we just have meetings among our civil society leaders that we won't achieve that. So I'd like to agree with that, so that young people do understand, even the constitutional provisions that entitle us to do advocacy with who? Government is free. How do we engage the executive? What kind of advocacy do we do with the executive? What kind of advocacy do we do with parliament? What kind of advocacy do we do with the judiciary? Because if you don't understand what kind of advocacy you do with the judiciary, you leave out another branch of government which is very powerful and can enforce something. But if you leave that out, you'll just be talking policy, and yet the judiciary is there. Of course, it involves technical issues. That's where now we bring that, the empowerment down to the grassroots. That the person understands we can go to court, maybe through what? The national human rights institutions. They are supposed to be assisting to monitor rights. How do we use them? How do we use them actually to get what we want? But I was returned from getting a service because this woman was preaching to me. We don't want that preaching. I want the service. We go through the Human Rights Commission, take up the complaint there, and if the complaints pile up, maybe the Human Rights Institution will say, what's happening? Let us address this. So anyway, sorry, I spoke already in the morning, but
Thank you very much. I think I wanted to first of all to commend the panelists. They brought quite substantive issues that require our attention and reflection. From one of the presenters, I think he was talking about the challenges of accessibility, affordability, but I think there was also a focus on cultural dimensions in terms of stumbling blocks towards effective access to sexual and reproductive health services. I was just reflecting, to what extent do we sometimes engage the traditional leaders as custodian of culture, especially on these issues? To what extent are we engaging religious leaders on sexual and reproductive health? Because we can be talking, and we have talked for a number of years, but maybe we haven't had a comprehensive kind of strategy on how best can we be seen eliminating effectively those stumbling blocks. That's number one that I wanted to submit. The second one is about the model policies at the Pan-African Parliament, SADC Parliamentary Forum. Are those kind of pieces of policy frameworks and the pieces of legislations really binding on national parliaments? Or we can, in a way, choose that we can domesticate this particular policy, but not this particular policy. Because all these issues that we are talking about, I think at SADC level, the sector of sexual reproductive health have had those model policies. But we don't seem to be moving towards effective domestication at national parliament level. The last issue is that I expected that we could have a reflection on the previous resolutions that we made in the more or less like an overview on how those particular resolutions have been implemented. But maybe tomorrow we might have that. I wanted to understand those particular strategies that were developed previously and how we have implemented. What is new during this particular kind of engagement, so that we are seen to be moving progressively and effectively towards eliminating some of the barriers, but also replicating the best practices. So this is the comment that I wanted to submit. Thank you.
Okay, thank you so much.
Thank you very much. Thank you very much, the panelists, and also for bringing up different issues. I will speak more on the Abuja Declaration and funding for the health delivery systems in most of the African countries, but I'll speak mostly for Zimbabwe. SRHR is funded mainly from donors, and there is a limited funding from the fiscus, which means our priorities in SRHR are mostly affected or according to the donor priorities. But the government, I heard one of the presenters saying we are supposed to be complementing the government efforts in health. So if the government is not funding its own health, what are we saying? The donor funding is shrinking and it's also dwindling. One day we wake up without condoms and contraception. So what am I trying to say here is young people, what do we really want to see? Where do we want to see change? We should be able to identify areas where we would want to see a change. In terms of funding, in terms of the Abuja Declaration, I heard for Zambia it's at 11, but Abuja Declaration is 15%. But that's the 15% for the health budget. What percentage of that 15% will go to sexual reproductive health? And for the sexual reproductive health, what percentage of that percentage will go to the adolescents and young people? So as young people and advocates should also be able to interrogate on some of those issues. Thank you.
Thank you very much. I can see we have a lot of interesting contributions from the audience, and I'd like to appreciate you all for your honest and powerful contributions that you have been giving throughout this session. So at this juncture, please allow me to release the panelists. If we will proceed with the conversation, I think that we will remain with the main chair. And from us, it's been an amazing experience, and we really appreciate you for giving us this opportunity to represent our fellow young people and make our recommendations. So thank you very much. This is where our panel comes to an end.
Okay, thank you so much. Now I will give this time to our media team. They have something for us before I call upon the regional director for youths, Nana Zulu, to give us the closing remarks of the day. Media team, over to you.
Hello everyone, are we having a good time? Yes. You guys sound so low. Are you having a good time? Yes. Are the young people in the room? Are the young people in the room? Yes. You know, if I was going to put this mic, I would be louder than all of you. If I was going to put this mic down, I was going to be louder than all of you. Are the young people in the room? Yes. Do you feel me? Yes. Are the young people in the room? Yes. You sound so old, man. I don't want to be with you right now. But anyway, I've got a video right there, and we're going to stand up, and we're going to do whatever our chicken is doing, because I think you're all a bit stiff, so we need you guys to be flexible, so that even when you come back tomorrow, you just know that you're all a bit of chickens in here. So I'm waiting for everybody to stand up. Stand up, stand up, stand up,
One challenge
and smile.
you are moving too much when we media.
Are we ready to rumble?
Because everything
Are we ready? Okay, great.
And that's it.
Thank you so much. Over back to you, Diana.
Thank you so much, Fafiru. I can see people are now smiling. My sister Diana is now smiling. Thank you so much, media team, for that. So now allow me to call upon our regional director of youths, Nana Zulu, to give us the closing remarks for the day. Come on, guys, you can do better than that.
Thank you. Good afternoon, all. Good afternoon. At least I'm coming after you're very well energized. So firstly, let me write on the protocols observed from the day. I note that we have a diversity of the participants in the meeting today, and it's really great to know that we have the members of parliament, we have the government line ministries, especially the ministries of health from various countries represented. We have traditional and religious leaders, UN agencies, civil society representatives, young people, the media, a whole diversity in terms of the representation here. Firstly, let me apologize for not being able to join you in the opening this morning. We did have a prior donor engagement that we couldn't get out of, so I made a commitment that I will be able to come through and hear the deliberations that are going through and be able to provide my support. So thank you for allowing me to say hello even as we end the day. I was very happy to sit in during the presentation for Dr. Kangaode. Him and I go years back doing work around adolescents, health and sexuality. So it's always nice to hear the different perspective he brings. I always tell him, you know, you make us see things from not the usual basics that we see it from. And I wish that we could have many moments outside this room where we can be able to reflect the same for our communities, but more importantly for our policymakers. So I hope that the legislators that we have here today will be able to take some of these messages to their spaces as well. This meeting is very important for us to be able to come together and have a reflection about where are we now in terms of ensuring adolescent access to sexual and reproductive health and rights, information, but more importantly, services. And this conversation becomes contentious because adolescent sexuality is often frowned upon. But the data from our different countries show us otherwise. We are seeing early sexual debut, we are seeing adolescent pregnancies, which tell us that we should be intervening much earlier. And we're also seeing the different generation that we're living in, and also recognizing the evolving capacities of children, and the fact that we need to be able to provide sufficient information for them to be able to make informed choices. So I hope that we really come up with great ideas about what we can do collectively together to move forward for our different countries, but also how we can create a peer influence across the region where we take this seriously. And this morning, you know, when you're doing advocacy, you're always talking about laws and policies. We need to do something about laws and policies. But today I was reminded, focus on the laws, because you can hold your government accountable to that. The policies, the governments will change and will keep dancing back and forth. So I think that for me really stood out during the conversation earlier in the day, that let's do a little bit more about the legal framework, and then we can move to knowledge, attitudes, and practices thereafter. Some of you in this room might also know that I'm transitioning this week from Hibbles. So this feels like a goodbye session for me. And I know I see very familiar faces that I've worked with over the years. In my role on the fund, I used to work on the fund, and in my role as the regional director. So unfortunately, earlier I had come with my colleague, the regional director from Latin America, who will be standing in to support the transition period for the team while I transit. But unfortunately, we didn't want to disturb the program. But I'm sure you all know Limpo and the team, and they're here to support you and support the actions that will come up from this meeting. So, hello and bye. And thank you so much.
Thank you so much, Nana Zulu. May we have a volunteer to give us a word of prayer? Oh.
Can you be a young person? Let us bow our heads and pray. Heavenly Father, we thank you for coming before your throne of grace. We worship you and we thank you for this wonderful moment and discussion that we had. Thank you for everything that we discussed, and we believe that you were among us. And as we have come again to you, God, we say, may you continue to help us in each and every framework, in each and every conclusion that we're going to make here. Heavenly Father, may you help us to make an impact and be able to change lives. So thank you. May you be with each and every person in this house. In the name of Jesus, we pray. Amen.
Thank you so much, Lord Green, for the prayer. I have one announcement for our international guests who are booked here at General Towers. Those who haven't seen the lady sitting outside in regards to their logistics, please kindly see her before you go back to your rooms. That's announcement number one. Announcement number two, tomorrow we are meeting at 8 a.m., same venue, and I'm hoping that tomorrow we'll be able to start on time. Thank you so much, guys, for today. See you tomorrow.
See ya.